Personalized medicine is about the tailoring of a very specific therapy according to the unique attributes of the patient and the patient's disease. Those unique attributes could have something to do with the genetics of the patient or the genetics of the disease or other physiological properties that can be measured. It's always been the goal of a clinician to provide the best therapy for a patient and to use what information is known about the patient and the disease to give the best therapy. But it's only been in recent years that we've had technologies that allow us to really go deep in terms of characterizing the molecular makeup of people and their diseases. And so personalized medicine is about taking this wealth of information that we can now begin to measure from the patient and the disease, and to understand what combinations of different properties predict for a very good therapeutic outcome for the patients. In my work, it's really about characterizing the genome using these new genomic technologies that we have available to us in ways that weren't possible before, and trying to understand how these combinations of alterations predict for the aggressiveness of the cancer. So there are various technologies that we have at Wake Forest for doing this. We have next generation sequencing, as it's called, which allows us to sequence genes tens of thousands at a time. But we also have technologies called microarray technologies that help us to ask a different kind of question, but similar. That is, how are genes turned on and off, for example, in a patient's tumor? And so we can profile human tumors that have been collected at surgery using this microarray technology to look at how their tens of thousands of genes are turned on or off. And then when you have hundreds of patients that have gone through this process, whereby they've given a tumor sample, we've profiled it, if we know the outcomes of those patients, how they responded to the drug, did the cancer come back, these types of questions, we can look at how genes or combinations of genes can be used to predict for those outcomes. And what we find is very encouraging. We find that compared to conventional wisdom, which are the markers that are used today by pathologists to predict outcomes of patients, that we can sometimes do better. Or we can find gene combinations that are very complementary to those markers that are currently used. And the concept then is to take that information into the clinic where it can impact on clinical decision making so that oncologists can make better decisions for their patients. My main area of research is in breast cancer biology and clinical aspects of breast cancer. And so using these genomic technologies such as DNA microarray technology, we're able to look at how expression patterns of genes can be used to classify human breast cancer in ways that haven't been considered before. So historically, breast cancer has been considered maybe two diseases, what's called estrogen receptor positive, estrogen receptor negative. But in more recent years, we've discovered there's another way to classify it. So there's a protein called HER2. We talk about HER2 positive breast cancer. And there are specific clinical treatments for each of these three types of breast cancer. But with the advent of these genomic technologies, we now know that no two cancers are alike, that there is heterogeneity across the board, and that what makes one cancer tick will not make another cancer tick. And so it is an opportunity then to use these technologies to better define the molecular subtypes of cancer. So by better defining, in a diagnostic sense, the particular type of cancer, the closer we get towards the goal of personalized treatment for that individual. And within those subtypes, we can begin to ask very specific questions about what makes this subtype of cancer tick. And once we understand that, then we can come in now with ideas about therapeutic intervention. Are there particular mechanisms active in a certain subtype of cancer, such as, for example, what's called triple-negative breast cancer, which is one of the more aggressive breast cancer subtypes, and say, here's the best therapy for this particular type of triple-negative breast cancer. These are some of the concepts that we deal with in the lab. So biomarker discovery research has the potential to identify unique combinations of genes or proteins or any other type of genomic or molecular markers that in combination can make better predictions about the outcomes of patients than anything that we have currently. And so you can imagine that having a combination of genes that can be studied in the context of a diagnostic assay or test would be an important contribution to the molecular toolkit that a clinician has with which to decide the best treatment for a patient. So it's our hope that this type of research is going to further personalized medicine at Wake Forest by enhancing our ability to make the right decisions for how to treat patients, selecting the right drugs, the drugs that the patient's unique attributes of their disease are going to be most responsive to.